All right, so welcome to NUR104. We're just starting our class tonight. This is the first class of the night. We're going to be talking about the syllabus. Okay, so I'm not going to read the entire syllabus, but I want to make sure that you do your homeworks. Don't fail the class because of not handing in homeworks. So we have 3 unit exams in this class. I like to do exam reviews. I don't know the flavor of the exam reviews that we're going to have this term because I don't know how busy I will be, but usually I do exam reviews based on a time that's good for most of the people in the class. So in the past, I've done reviews on Saturday afternoons, Saturday morning, Sunday afternoon, whatever is best for the class. So let me ask you this, when is a good time for us to do a test review?
Probably Sundays because we have clinicals starting on Saturdays soon.
Okay, so Sunday is a day that you don't have clinicals? And that's for everybody? Okay, this is the time to speak up. Is
Yeah,
Sunday?
Sunday works for me.
Sunday, okay. Last term I did Sundays like 4 or 5 o'clock because I had 2 classes and I would just do my other class from 4 to 5 and then from 5 to 6. So I think that could be a good thing for us to do. Okay, so Sunday, and I will post it in our announcements. I'd love to use the announcements, so please check your announcements. Okay, I see Micaiah says yes. Okay, somebody just joined. Let me see who this is. Who's this? Okay, who is the student that just joined? Oh, they don't have their sound. Okay. Okay, I'm just going to give them an opportunity. Once you get logged in, you can answer put any questions you have in the chat. We're just going over the syllabus, establishing the time when we're going to have our exam reviews. I also like to put a blueprint in the announcements, and the blueprint is not telling you exactly what's on the test, but is helping you focus on the items that you definitely need to know. Okay, because I know there's a lot of information in these chapters. Okay, quizzes, that's 5% of your grade. You have a fundamentals specialty exam, and we're going to go over how to study for that because I want you to start studying for that exam today. Okay, I don't want you to wait until the last minute. I do plan on having HESI review sessions. We started that last term and it was pretty successful, I think. Let me see. All right, the new student that joined, who is that? Can you change your name so I know who you are? You don't necessarily have to put your camera on, but I just want to know who you are so I could do attendance.
It's Raven.
Hi, Raven. How are you?
Hey, Miss Ignacio, how are you?
Good, good, good. Thanks. All right. Can you access all of your resources?
Uh,
Evolve and Kaplan or anything, the case
I
studies?
don't have Kaplan, but I can get an Evolve though.
Okay, now let me make sure because I think we stopped using Kaplan. So I take that back. What about Saunders?
I can get into Saunders.
Okay, so that's good. All right, fantastic. And I'm glad that you're here. All right. Okay, so case studies, wellness care plan. I'm not 100% familiar with that, so I'm gonna look it up and give you some more information about it, but that's 4% of your grade. Okay. When you do these Saunders questions, you may have been told this already, but I'm just going to reiterate because it's super important. Make sure that you're looking at the rationales. Just don't do the questions to say, oh yeah, I got to do 20 questions because my instructor told me to do 20 questions. Really get down into the questions, do your very best. If you see something that you don't understand, look it up and bring those questions to class, okay? What I'm going to try to do this term is to be really proactive and to let you know ahead of time what's going to be covered in class, because I know some of you may have anxiety and that will kind of help you. Like, okay, she told me she's going to cover this in class. So if I'm prepared, that will make me feel a little more calm, because when you're more calm, you'll be better to absorb the information. Okay, so you have a clinical with this class. Don't miss any clinicals, okay? That's so important. I understand life happens if there's an emergency, you get a flat tire, excuse me, you get a flat tire, something happens, get all documentation and forward up the chain of command. That's going to be really critical for you. Okay, the chain of command, I mean, your clinical instructor, you can include me as your classroom instructor. You can also include me as the assistant dean of nursing, excuse me, and also include the dean of nursing as well. Okay, you have to get all of your clinical hours. Okay, has everybody here been cleared by Mrs. Clemens for clinicals? Has anybody not been cleared, I should say?
This is Erica Taylor. I haven't been cleared. I'm having trouble getting the chickenpox vaccine.
No.
Is there like
No.
a shortage or something? Or
Yes, no one has it. The only thing that they're offering is the shingles, and it's like 2 different vaccinations you have to get.
Oh, okay. Did you get a titer? Are you not immune anymore?
Well, that's what is that? Castle Branch said I needed.
So I think with varicella, you should be able to get a titer because I've gotten a titer before. And excuse me. And so if you are immune, right, because you've had it in the past, I'm assuming,
Yes.
if you get the blood work done and if you have your immunity, then you don't need to get the vaccination again. So I'm going to send a message after class to you and to Mrs. Clemens just to make sure that I'm telling you the truth, but that's how I understand it to be. And I didn't realize there was a shortage of chickenpox vaccine, but I think you can get the titer, and that's just a blood draw. Okay. All right. Anybody else not cleared for clinical in this group?
I'm not clear
Me,
yet. This is
I'm not
Raven.
clear.
Okay. Well, what's going on? Let's talk to Raven first. Raven, what's going on?
So the only thing I have to do is, well, I still have to upload my stuff into Castle Branch, but I've been having an issue with that. Is for some reason I've been having problems trying to upload it, but I have all my stuff. I got my titles and everything from my job from CHKD and everything else. I got a current TB, but the only thing I have to do is my CPR and first aid because it expired. So that's the only thing I have to do.
Okay, well, we have a CPR class coming up on April 22nd with Dr. Adongo. I didn't see your name on the list.
I remember I emailed you and you told me that you would add me to the list. It was like a couple of days ago and you copied him on it.
Okay, did he respond to you?
No.
He didn't respond.
Mm-mm.
Okay, so I'm gonna remind him because I want to make sure that you're on that list because he has a limit of 12 people and I think he has like 7 people right now. And I
Mhm.
want to make sure that you get it. Okay, so let me just write this down, Raven. CPR, and it's Dr. Dongo. It's $35 in cash made
Mhm.
payable to him.
Yes.
Okay, fantastic. Okay, thank you, Raven. So the issues you're having with Castle Branch, that's okay. Castle Branch is, sometimes not the easiest to work with. Make an appointment or see Mrs. Clemens during her office hours. Okay.
Okay.
Excuse me. Okay, and then Deborah, excuse me, was the other one. She said, sorry, still under review.
Yeah, I submitted my immunizations. I had all of those, my TB, my COVID, my flu. I had all of that from my job because I work for Centera. But my I forgot what I was going to say. Oh, my CPR. We do CPR every 3 months at Centera. So I'm not sure how. It's not like a 2-year thing. They make us do it every 3 months. So I'm just trying to figure out.
Okay, did you, excuse me, I know it's Centera, so I know it's AHA. So do you
Yeah, it
have a
is.
CPR card that you could upload to
No,
Castle Ranch?
we don't get a card. They make us do it every 12 weeks through the system. So I'm not sure if I would probably just have to let Miss Clemens know.
Yeah, you're gonna have to make an appointment to see Mrs. Clemens, and you don't want to dilly-dally, in case she says that she can't accept that. Because I'm not familiar with the Centera, like if it's an actual card or not. So you don't want to wait. Okay, so let me just write this down. So CPR and your pending immunizations.
Yeah, I already submitted my immunizations and my tithers and my TB. I already submitted all of that. I'm just waiting. It's under review.
Okay, that sounds good. Okay, was there someone else? But I have Deborah, Erica Taylor, and Raven. Those are the ones that are not clear for clinicals right now. Anybody else?
No, this is Erica Taylor, so I could just get that blood work from have my doctor do that.
Yes, I believe you can, but after class, I'm going to send an email to Mrs. Clemens and include you because I want to make sure that that is the correct guidance. I'm pretty sure that you can, like I said, that I've got it done. But the thing is, it has to come back that you have immunity. Now, if your titer
Right.
comes back negative that you don't have immunity, we're going to have to search high and low to get you that chickenpox vaccine somewhere from somewhere. Okay?
Okay.
All right. So yeah, that should be easy enough. So I'll send this email after class. Makaya, what is the issue? You don't have clinical clearance either?
No, I spoke with Ms. Clemens already and we addressed what I need to take care of. So I'm currently taking care of that so I can upload it to Castle Branch.
Okay, so you're getting that done. Okay, excellent. When is you all's first clinicals?
In May.
In May.
Well, see, Miss Nacio, this is the thing. So when I talked to Miss Clemens the other day, she stated that because I was asking her if I could start the clinicals with the group for the 29th. Because my clinical doesn't start until May. But then she stated that they're supposed to be grouping all of us together because the class is not big enough to break up.
Mm-hmm.
So I don't know like what's what now because I know that we supposed to have like they broke us up into PM1, PM2, and then some of us had lab at 5:45, some of us had lab at 8 o'clock. But now she's saying that they're supposed to come down, all of us, but they still haven't told us anything yet because I mean we need to know what's what so that we can know.
Yes, and that is definitely true. So I know that we just had a faculty meeting, excuse me, right before this class. And they were talking about the changes, and the changes are still actually being made because the students drop and come back and all of that. So hopefully by tomorrow, everything will be updated in the system. But they are aware of it, and she did send out a notice in Dean's Corner. So make sure that you're keeping your eyes open for that announcement and make sure you're checking my campus link, okay?
So she sent something out in Dean's Corner. I must have missed that because I usually check it. She sent something out about
The
um
schedule's changing and
schedule
updating.
changing.
Yes, I think she
Okay.
sent that this afternoon sometime. Okay, and I
Oh
know there's
yeah, I see it.
okay, so I know that there's a lot of information in Dean's Corner and it's the first, beginning of the term and we're trying to get our battle rhythm and how we're going to study and what we're going to do. We're trying to figure out where our kids are going to be and all of that. So I get it. And so that's why I know we're spending a lot of time on this, but I want to make sure because we have students now that missed some sims, they missed some labs, now they're missing hours. If you're missing those hours, you can't pass the class. So it's really important for you to get everything squared away, okay? And I can't emphasize that enough. All right, so I think we're good with that. I think you all know that. Please, when you come to class, make sure you bring your textbooks. Okay, and the textbook is going to be the fundamentals of nursing for this class. Also bring your Saunders book and also bring your Hesse, your green Hesse book, because that's going to be the 3 books that we're going to really lean upon. When you go to clinical, have your clinical bag, your blue bag. When you go to simulation, when you go to skills, have that blue bag that has all of your supplies. It's better to have it and not need it than need it and you don't have it. Now, obviously in clinical, you may not be able to bring that big old bag, but when your clinical instructor contacts you and says, come prepared, ask them specifically, what equipment do I need? Please don't show up without a stethoscope, okay? That's the first thing. Have a black pen, all of those things, right? Make sure that you have the right uniform. The new dean is very strict about the uniform standards, and I don't want you to be sent home and receive a 0 because you have acrylic nails. Like, come on, we're beyond that right now. So please make sure that you govern yourselves accordingly. Black shoes are authorized in the classroom, as well as white shoes. That's a change, okay? And your hair has to be up and back and off of your collar, in a bun or in a French braid, but no ponytails, okay? She does not want any ponytails. Okay, and so it's kind of good that I don't physically see you right now in class, because that gives you another week to get yourselves squared away. If you got a hair situation going on, I get it. Wear a scrub cap, okay? So, and that's easy enough. If you have a nose piercing and you can't find a clear spacer, wear a mask. Okay. All right, let's continue. We spent a lot of time on that. We'll talk about the HESI. You have to get a 900 on the HESI. You have to do the remediation for the HESI. If you don't do the remediation, you're not going to get the points. Even if you get 1,000, which will be a part of the 1,000 HESI club, which is cool, you get a cool pin, but you still have to do the remediation, and that would be 1 hour of remediation. Okay. All right, going on, going on, going on. This kind of tells you the time that you need. Okay, I think you get that. Week by week, it tells you, excuse me, the chapters and everything that we're going to be going over. So tonight, we're going to be going over chapter 27, chapter 40, 28, and 15. That is my plan. Okay, week 2, we're going to be going over all of these chapters that have to do with the nursing process. Okay, and so that is the bread and butter of what we do as nurses, the nursing process. Okay, and that's how we need to think. That's how we're going to be getting ready for next generation and NCLEX. Okay, so it's important. Then week 3, excuse me, week 3, we're going to be doing chapter 38 and 39. Your test, actually, no, okay, let me go back. Because your first test is week 3. So week 3, you're going to have your first test, and that's going to be the content that we go over today and then next time. Okay, so that's why we can't delay going over material. Okay, we have Brianna that just joined. Brianna, welcome. How are you?
Good. How are you?
Good, thanks. Okay, do you have access to all of your resources, and can you get into Canvas?
I think so, yes.
Okay, all right, perfect. All right, so Sundays we establish will be review days. I'll do a Zoom. So I'll post that in the classroom. We'll do a Zoom and it will be recorded. I probably will just email you the link once I make the recording. Okay, all right. Any questions about the syllabus? I'm not going to go over every single thing, but I just wanted to highlight those things.
I just have a question about the clinical clearance thing that I missed.
Okay, yes, are you cleared for clinicals, Brianna?
I don't think so because I literally just submitted my stuff the other day. I just figured out how to do it.
Okay, so what you need to do then is, let me just write this down. Okay, not cleared for clinicals. Okay, you're gonna have to make an appointment with Mrs. Clemens because you're going to have to get a clinical clearance letter. You cannot go into clinical unless you have that clinical clearance letter.
Okay. How do I make an appointment with her?
So she has office hours, and I'm gonna send an email after this to, excuse me, to Mrs. Clemens, including you, so you can start that dialogue so it's easy for you. Okay.
Okay.
All right. Thank you for letting me know, Brianna, and I am glad that you're here. All right, let's go.
Miss Nasir, real quick, is
Yes.
class at 5:30 or 5:45?
That's a great question. I don't know. What time do you get
Because
started?
our schedule said 5:45, but I believe everybody was in class at 5:30. So that's why I was like, I was running a little behind because I thought it was at 5:45. So
Okay,
our
well,
schedule say 5:45. It's 5:45 or 5:30.
okay, well, let me ask the class because I don't really know what your schedules say. So what time do you all think the class starts?
My schedule has 5:30.
Mine past 5:30.
Okay.
Mine has 5:45. So I guess everybody got something different.
Okay, so I was on the impression that class starts at 5:30. So we'll plan on 5:30.
Okay, that's fine.
Okay, so yeah, because we want to make sure that you get all the hours and everything. If you're ever running late, I don't want you to put yourself in danger to get to class. Like, your safety is the most important thing to me. Like, I get it. Some of you are rushing from work and everything else. So please be safe, okay? I don't think we really have to worry about snowstorms or anything right now, but you never know what could happen. So your safety is my number one concern. If you're running into danger, just send me a text if you can. If you can't, just let me know as soon as you can, right? So that's going to be, your safety again is the most important thing. All right, let's jump into Evolve. I want everybody to log into Evolve because I want to make sure you know how to do these questions. So your green HESI book, that's how you're going to prepare for the HESI at the end of this term. Okay, so we are going to log into Evolve. You're going to get to your green HESI book and click under student practice questions. Once you get there, you're going to click and you're going to begin. So let me go back. There's study mode and there's exam mode.
Are we supposed to be trying to do that right now?
Yes, because I
Oh.
want to make sure that everybody knows how to do it, because this is important, because I want you to start doing questions tonight, even if it's just 5 questions. Because if you do it in little chunks, little increments, by the time you get ready for the HESI in, less than 12 weeks, you'll be ready to go. Okay.
How do I click while I'm on the Zoom thing on my computer though? Because it's not letting me click out of it.
You might have to minimize Zoom.
Okay.
Okay, and you can also get to that book through your modules under student resources. I'm still sharing my screen, and you should see HESI comprehensive review for NCLEX. And it's going to open up for you. It might not open up for me. Okay, let me see. But under student view, you should be able to see it. Okay. Let me see, where was I? Okay, just everybody kind of give me a thumbs up so I know that you're there so we can move on.
I mean, I'm not there, but I'm watching.
Okay, now I really want you to get there because I don't want you to say, oh, I didn't know, I didn't remember. So I want you to physically do it.
Oh, I can't because I can't figure out how to get this Zoom thing out of my face.
Okay,
Probably got it on a full screen
How do I minimize that?
because it's in the corner, in the right hand upper corner.
It's not on mine though. Like I can see all my other tabs open. That's what's like weird. I don't
No, because I thought the same thing, but it's there, it's in the corner. You just have to see it because Miss Ignacio's screen is covering everything. You just have to your screen is full, that's why.
Oh yeah, I got it. Okay, thank you.
okay, awesome. Okay, very good. So everybody else has it. I see Micaiah, Shaitavia. Okay, good. Okay, who was that? Brianna. Okay, thank you for helping. Who's that? Okay, now that you got it, I'm going to go back to share. Okay, so for this, there's all these different exams here, but for this class, you're going to be focused on fundamentals. So you're going to begin the study session and it's going to let you take these questions. Now there's 125 questions. By the end of this term, you should have exhausted all of these questions in order to prepare for your fundamentals HESI. Okay, so that's why if you do, 2-3 questions a day, you'll easily get to exhaust all of these questions. When you do these questions, I just don't want you to do it for the sake of doing it. I want you to try to break the question down, ask yourself, what is the question asking me? And when you choose the answer, right, if you don't get it correct, I want you, and even if you do get it correct, I want you to look at the rationale. I want you to read through if there's any terminology, anything that you don't understand, look it up, look in your textbook, ask me a question in class, because that's the way that you're going to be successful, because there's 125 questions. Do you think that some of these questions you're going to see again on your HESI? And I'm going to tell you, yes, it may not be the exact same question, but it's going to be the same topic, right?
Miss Ignacio, quick question.
Yes.
So where are you at? I'm in Evolve, but I'm not where you're at. I went to student, I went to,
Okay, let me share my screen and I'm gonna go to the green book. So you should go
oh,
and then
okay,
go
hold
to
on, wait.
student practice questions.
I don't think I have, wait, I don't think I have my, 1 second. I don't think I have my the HESI book downloaded.
Okay, so that's good that we find that out now. And we have Shantae that joined. Hello, Shantae. I'm glad that you're here. We are just going over to make sure everybody has access to Canvas and to Evolve. Do you have any issues with it, Shantae?
Mm, okay, no, I have Miss, so I have to put in the green one. I have the old, the other HESI from when I have to download it up here, and then I'll go in and put it in so I can have it.
Okay, but you know how to do that though, right?
Yes, I know
Okay.
how to do it. Go in and
Okay.
do it.
Okay.
Mr. Ignacio,
Yes.
I'm sorry, but I went into Evolve and it's not letting me click on student practice questions. I went inside and it just says student practice questions and then
Okay. What is it showing you?
it's just showing me Evolve Elsevier student practice questions, but it's not letting me.
Okay. Do you have pop-ups blocked? Because that could be one of the things.
Mm,
Maybe you
Mine
have
did
to.
that, and then I had to refresh the page.
oh, oh, it says search resources now. Is that correct?
I'm not really
No.
sure what you're seeing. I just know that you need to get to the green book. Do you see the green book?
Yeah, I saw the green book. I clicked on.
Okay, good. So when you click on the green book, go to student questions.
Hold on. It's HESI comprehensive review for NCLEX,
Yes.
and then no, it just took me straight to student practice questions. Maybe I don't have the book on here.
Yeah, that's student practice questions. Yes, that's it. So you should see the green book. Do you not see the green book?
No, ma'am.
Okay, when you click student practice questions, what do you see?
It doesn't let me click it. It just it doesn't let me click anything on it.
Okay, so
It just has the Evolve Elsevier and then student practice questions. I refreshed the page.
okay, does it look like this? What I'm sharing, is this what you see?
I click that
Okay,
and then no, I don't see that. Hold on.
it might be something in your settings, like if you have pop-ups blocked or something.
Okay, I see it now. I had to click. Hold on.
Oh, yeah, I don't have that book up here. I have a different.
Okay,
link.
yeah, I got it now. I had to go into the
I got it too.
Okay, yay. Okay, let's go over that again because I feel like not everybody's getting it. Okay, so under modules, student resources, you're going to click student resources. And all of these books are here. I recommend that you go in and just kind of, play around with it. The one I'm going to show you today is the HESI Comprehensive Review for NCLEX. Excuse me. And that's the one that I want to make sure that you have so you can start studying for your HESIs. Okay, so you can do it in study mode where it's going to give you the rationale, or you can do it in exam mode where you're just going to take a straight test. Okay, anybody not see this now?
You said study mode or exam mode?
Yes, you can do either one. Now, since we just started the class, I would say do it in study mode because you haven't really had a lot of the material, so it's going to be new to you. But if you feel, say that again.
Do we turn those in?
No, this is for your own self-study. This is to
Okay.
help you get ready for HESI. Okay. Okay. Oh, maybe we should do a competition. I like that. Maybe we should do a competition. If you turn in, you can get like a gift card or something. I like that idea. Okay. Yeah, we can do that. Yeah, let me think about it. And we can do that. Okay, turn in questions. Okay, yes. Okay, excellent. So everybody has that resource. Okay, fantastic. All right. Modules. Okay, getting started. Week 1, everything that you need should be in here. And everybody told me that you have access to this. All right, so we're gonna jump in to chapter 27. And I'm going to actually put you, excuse me, into breakout rooms because I want you to discuss the certain topics. Wait, hold on 1 second. I'm going to give you 5 to 10 minutes to discuss these topics amongst yourselves and come back, and then we're going to talk about it as a class. But hold on, I got to get my list. Hold on. Okay, so I'm back. What time do you all's schedule say this class is over?
8:50.
8:50.
8:50.
Okay, all right, so we're in agreement for that. All right, we're gonna look at chapter 27. That's gonna be the first chapter. Let me see how many of you. 1, 2, 3, 4, 5, 6. All right, we're gonna put you into breakout rooms, and I'm gonna give you the topic, and you're going to discuss amongst yourselves, and you're gonna come back and give us the highlights of the section of your particular area. All right, I'm gonna do 3 breakout rooms. Okay. Okay. Let me see if everybody can be in a breakout room. Actually, we could do 4 breakout rooms. Okay, perfect. All right, so room 1 is going to be Brianna and Deborah. Room 2 is Micaiah and Shantae. Room 3 is Erica and Madison. Room 4 is Shaitavia, and I think it's Raven that is listed as student. Okay, let me just change that. Okay, and so for room 1, you're going to look at the section in the textbook entitled Motor Vehicle Accidents. And the intention is to go through it and you're going to draw out the highlights. And I want you to think about it in terms as a nurse. What would I teach my patients about motor vehicle accidents? How can I prevent motor vehicle accidents? So those are the kinds of things you're going to look at. So that's room 1. Room 2, you're going to have falls. Okay. And room 3, you're going to have fire and disasters. Okay. And then room 4, you're going to have immunizations. Okay. Any questions on your assignments?
Erica, what number are we?
We are 3. We are fire and disasters.
Shatavia, we
Thank
4,
you.
right?
Yes, we're 4. We got immunizations.
Okay. All right. Fantastic. I'm going to send you to your rooms. I'm going to give you 10 minutes. Good luck. Okay, Alexa, set a 10-minute timer. Okay, welcome back, everyone. And let me know if that time was too long. I wasn't sure if that was a long enough time or if it was too short or what. Let's go to those who were in room 1.
We were in room 1. This is Deborah. We were supposed to talk about motor vehicle and safety for motor vehicles.
Okay.
We discussed infant and toddlers, safety, rear facing car safety seats until they reach a certain height or weight. We would speak about rear forward facing car seats for children over a certain weight until they reach a certain weight. Children 12 and younger should be restrained in the rear seats of vehicle. And we also talked about the teenager to young adult drivers 16 and 19, the age groups, and a lot of deaths from cell phone or texting while driving.
Yes.
And we talked about the texting while driving and speed for younger adults and teenagers.
Okay, awesome. Excuse me. Okay.
And Brianna talked about some other stuff too.
Okay.
Yeah, I talked about older adult drivers testing their eyes and stuff again. Them driving in good weather, daylight, and then the safety of the vehicle, such as having like working seatbelts and airbags.
Okay, awesome. So it sounds like you all touched on a lot of great things. And of course, the seatbelt is going to be a big thing. And with your geriatric patients, they have a slowed response time, right? So they can't really multitask that well. So they should definitely not be texting and driving. No one should be texting and driving, but their response time is delayed. And so that can also cause issues as well. A lot of times your geriatric patients may also have Alzheimer's, so they may forget where they're going. Okay, so excellent. All right, anybody have anything else to add? Okay, awesome. Let's go to room 2.
We had falls. So falls are ranking at the second leading cause of accidents or unintentional injuries and deaths worldwide. Okay. Falls contribute to disability, lost work time. In case of many older adults, that's the leading cause in older adults, of course. Fall preventions has been a major quality healthcare initiative. And some other risk factors are alcohol or substance use, or poor mobility, unsafe environment, and also in the healthcare throughout the country, they carefully monitor for incidents and falls and related to injuries. Okay. And that was
Okay, awesome. Who was with you?
Shawan. I'm not Shante.
Okay. Shante, do you have anything to add? Shante, do you have anything to add to what Makaya mentioned? Okay, we're gonna continue on. Okay, room 3. Who's room 3?
Erica.
Madison, we had fire and disasters. So with the fires, the number one cause of fires are space heaters and cooking. Far as space heater safety, keep away from children and pets, plug only into an outlet. Make sure you have a working smoke detector and a carbon dioxide alarm is working. Look for any signs of malfunctions. Keep away definitely from anything that's flammable. As far as cooking, make sure you have a fire extinguisher nearby and know how to use it definitely. Turn the pot handles towards the back. Don't wear loose clothing when cooking. Make sure you clean your stove and burners to prevent grease fires. And also, improper disposal of cigarettes can cause fires, like throwing it into a garbage bin full of papers. And far as like in the healthcare setting, they have routine fire drills to measure staff responsiveness. Definitely the RACE protocol, try to rescue patients and size up the fire and then start your rescue if possible.
Okay, very good, Erica. You were saying a lot of great things there. And your partner does your partner have something to add?
Yeah, she's doing disasters.
Okay.
I had disasters. It's disasters such as floods, hurricanes, and etc. are major causes of death, along with biological agents that leave a lot of people homeless in the United States. When a disaster comes, you just want to make sure your hospital is prepared with the proper training, staff, resources. That's pretty much it. Mine was a little small.
Okay, no, that's excellent. Okay, so you all did a good job. I want to make sure you all know what RACE and PASS stand for, because those are the things that test questions are also made of. All right, what does the R in RACE stand for when we talk about fires?
Rescue.
That's right. So rescue our patients. So if there's, a trash can fire in the solarium or the open area where all my residents are, I better rescue those patients. That's the first thing that I need to do. Okay. And then what is the A?
Alarm.
Yes, that is the alarm. Okay, very good. I better pull that fire alarm or yell out, whatever the, protocol is for that facility. I better be following that protocol. Okay. And what is the C?
Contain.
Confine, contain.
It's
Confine.
contained.
Right,
Mhm.
confine or contain. So that means I'm shutting those double doors. There's fire boundaries. I have to shut the doors of the residents in their rooms, because we know that if there's a door that is closed, that's less of a chance that the fire can spread, right? But if the door is wide open, that fire is going to go to the path of least resistance, right? Okay, very good. And what is the E for?
Extinguish.
Extinguish. Okay, so that's important. I've seen a lot of questions on that. Now, when we are extinguishing the fire, PASS is going to be what we use. What is the letters in PASS stand for?
Pull the pin. P is for pull the pin.
Pull, aim, squeeze, and sweep.
Sweep. Yeah. Pull,
That's
aim.
right.
Okay, Erica.
Okay, so
I mean, I know them because we have to learn them at work at CHKD, so that's how I know.
Yeah, you definitely have to know that. Like, that's not just for NCLEX, but that's like real world. Holy smokes, literally holy smokes, I guess. But yeah, so that's something that you could, I promise you're probably going to see that on a test sometime this term. Okay. All right. Excellent. I put a link in the chat. I want to make sure you all know about Nurse Sarah. You probably already do. Disaster nursing sometimes can be a little scary because it's not like what we're used to. We're used to trying to save everyone. Disaster nursing, I want to tell you, this is a situation that's not a normal scenario. So we may have like a mass casualty. So there could be a large shooting, it could be a large accident. And so whenever we have these mass casualty scenarios, excuse me, it's the resources and the medical staff is not enough to take care of all the people that are affected or injured. So we have a tagging system, and this, I think, sometimes is difficult because when a patient has a black tag, that means that death is imminent. Okay, so the color codes, you definitely need to know the color coding. black, green, yellow, and red. So let's talk about the black tags first. Black tag expectant, I expect this patient to die. Here's an example. It's, a 10, 15, 20 car pileup. The patient has a car still on top of him or her, and I see brains oozing out on the ground. That patient is a black tag. That means they're going to die. I can't waste any resources. And I don't want to say waste, but I can't utilize any resources because this patient's not going to survive. Okay. Okay. So there's absence of breathing, circulation, or mental status. That is a black tag. Okay. So sometimes in my life, when there's a situation, I'm like, okay, this is a black tag. I'm not going to spend any more time on it because it's dead. Right. So the next color I want to talk about is red tag. Red tag is someone that could survive if they get immediate attention. This is the patient that you want to get medevaced out in a helicopter, or that when the ambulance is coming, they're going to be the first one. Okay, that we see. So it could be like spinal cord injuries, hemorrhaging, burns, respiratory trauma. Those are the patients that they could survive if they get seen right away. That's your red tag. So they're immediate. Yellow tag is, okay, these patients, they need to be seen, but they could hold on, right? Not for a long time, but they are not that critical as a red tag patient. So fractures, right? If they have open wounds or lacerations that are not like bleeding out or hemorrhaging, then they can, hold on. So the green tag, those are the walking wounded. Those are the ones that can help with everybody else. Okay, so it's important for you to know this tag kind of scenario. Have you all heard of this before?
Yes.
Yes, okay, awesome. Okay, fantastic. No? Okay, that's okay, but you know it now. And Nurse Sarah has a really good video, and she kind of walks you through it, even though we walk through it, but she goes into very great detail. You will see this kind of stuff again, especially when you're in community nursing. So this isn't something you should forget. You're definitely going to see it again and again. Okay, room 4.
All right, so that was me and Shatavia. I'll start it and she'll finish it.
Okay.
We had immunizations, and basically immunizations is childhood vaccines is basically one of the most effective public health strategies. It's basically there to control and prevent diseases. Immunization reduces and in some cases prevents the transmissions of diseases from person to person. One of the facts that we read about in the book is that parents, a lot of parents have concerns that autism may be linked to vaccines that children receive. So a lot of parents pretty much are thinking that because kids have because kids are getting vaccines is basically called autism. Is what they're thinking. So I'll let her do the other part.
Okay.
Right, to pick up where she left off, parents aren't really getting their children vaccines as much as they should because they do think that they are linked to autism. However, that hasn't been scientifically proved, and the same goes for SIDS. Some parents feel like their children are gonna end up with SIDS and die too because of the vaccines, but that hasn't been scientifically proved either. So it's very important, starting as as 2 months, babies do get their vaccines, especially their Hep B. Eventually, coming into adulthood, we have to get 3 series, especially if you work in healthcare facility, you have to get these vaccines anyway to sometimes even keep your job. The nurse's role in this, of course, is to just educate our patients as much as possible, provide them with documentation as well as any links that we can give them to let them know, hey, here's the reason for the vaccine and why it is such an important thing to do. However, you still do have some families, because of religious backgrounds or even their just lifestyle in general, that they don't believe in vaccinating their children. So we can push them with all of the information that we possibly want. However, their culture is like, no, we're shying away from vaccines. They do have the right to do so. Just hope that they don't get the vaccine and die. Switching gears, get the disease and pass away. Switching gears to the older you get, you have to get a shingles shot. And I believe the age might be 50. It might have changed. I can't remember exactly, but that pretty much shingles lives in everyone. However, some people it comes out, some it lays dormant. I forget the specific area that it lays in your body dormant, but certain things can pull that out, such as stress or anything that alters the body normal rhythm can pull out shingles, and even someone as young as my age can get it as well.
Okay.
So it's very important to receive that vaccine also. That's pretty much it with vaccines.
Okay, awesome. So you did mention a lot of great things. Group 4, you did a great job. Excuse me.
Thank you.
You're welcome. So this is going to be an important point for your geriatric patient. And so sometimes it is 50 years old, sometimes it's 60, 65, but definitely the geriatric patient needs to get their flu shot, their COVID shot, their pneumococcal vaccine. All of these, vaccinations are going to be important because as we get older, our immunization, our immunity decreases, right? As well as other things decrease in your geriatric patient. A lot of times, your geriatric patient is living in close proximity to other people, so that's a consideration as well. Okay. All right, so you all did a great job interacting, and I appreciate that. And I like to hear students interact because I also like to hear what your thoughts are. And if you can teach this information to someone else, that means you really understand it. So that's kind of the method to my madness. Um, in the chat, I have put all of the PowerPoints. Some people like the PowerPoints, some people don't. But if you like the PowerPoints, there they are. You can definitely download them and have them for your use. I'm just going to kind of quickly go through to make sure that we haven't missed anything. But I think you all got a big chunk of what's important from this chapter. And so in case you're wondering how to study, because this is like a lot of information, right? There's 4 chapters. The next session, we're going to have like 5 chapters. How do we study? Well, what you did is actually one of the techniques that I wanted to make sure that you knew is looking at each section and pulling out the important information and applying it as a nurse. So what do I have to know about motor vehicle accidents? What do I need to tell my patients about immunizations? What is my role? Am I immunizing? Am I educating? Am I doing a medication reconciliation to see if my patient has received their immunizations? So that's how you always want to think, okay? So I'm sharing my screen again, and you should see chapter 27, patient safety and quality. So we're gonna quickly go through this to see if there's anything that has been missed or anything that I want to highlight for you, okay? And so I kind of know, I think a lot of you in this group, and I think you all have a lot of good experience as far as in the healthcare field, or I can already know that you're critical thinkers because I remember you all also from orientation, some of you. Okay, so when we think about this topic of patient safety and quality, we have to incorporate critical thinking. We're not just robots passing pills. We have to think about what we're doing and how it affects our patients. Yes, we have accrediting bodies, we have agencies that we have to answer to. And so you may, at your job, some of you, they may have DMV or they may have JACO. They're like, oh my gosh, JACO is coming, JACO is coming, or whatever the inspection team is, right? And they start freaking out. I would submit to you is to act like you are being observed at all times. So if you do everything in accordance with, when it's time for these inspections, you don't have to kind of, be freaking out, okay? You just have to do a little fine tuning, okay? But we always want to make sure that we have patient-centered care and we're providing for our patient in a safe manner. Whenever we are looking at nursing, we are evidence-based. And I really like what Shatavia said. She said, hey, there's no evidence saying that vaccines is causing these conditions, causing autism, causing other concerns, right? We are evidence-based. So we're not getting our information from TikTok or from Twitter. No, we're getting information from Mayo Clinic. We're getting information from Cleveland Clinic, the CDC, credible sources. That's where we're getting our information from. One time I had a student, not at this school, but at the first school I taught at, and she said, I don't read. And I was like, well, how did you get the information you got for the answer to this question? She said, I Googled it. And I was just like, oh my gosh, what are we doing, right? So please don't be, don't be. Now you can search for information because I search all the time, but make sure you're getting it from a credible resource, okay? So environmental safety, everything in the patient's environment is what you need to be looking at. If you're a home health nurse, that means everything, as soon as you come through that property, the door, are there scattered rugs? Is it a hoarding situation, right? How's the temperature? Are there trip hazards? Is there adequate lighting? All of that is going to be important. I've seen a lot of test questions. The patient is concerned about getting up at night. Well, if they get up at night to go to the bathroom, I better make sure that it's well lit. They can push the call bell for assistance prior to, right? But those are all safety things. Excuse me. All right, basic human needs, that's Maslow's hierarchy. Who does not know about Maslow's hierarchy? Okay, so everyone knows you want to meet the patient's physical needs first. That's going to be important. And of course, I think somebody mentioned that this oxygen, that's a fire risk. I'm always flabbergasted when I see someone with oxygen and they're smoking cigarettes, right? It happens. But yeah, oxygen is a fire risk, so we have to make sure that it's grounded and handled in a safe way. So nutrition is going to be important for our patient's health, right? Healthy food, healthy choices. That's one of the things as nurses we have to be aware of. Temperature as well. Certain populations, extremes in temperature can cause them harm. Here's an example, newborns. We are really concerned about them because they can't thermoregulate. So after we make sure their airway is clear, we have to dry them off because of cold stress. What cold stress can do is increase metabolic demand and then put them at risk for hypoglycemia. Your geriatric patient is also very vulnerable when it comes to temperatures, heat and cold, because we know they're thin, their skin is thin, so they're at great risk for hypothermia, and they're also at great risk for heat exhaustion, right? So the summertime is coming. They always, go on the news and say, check on your senior citizens because sometimes they may not have air condition. If there's a heat wave and we have a power outage, they may not have, an adequate way to cool themselves. Excuse me. So those are things that we have to look out for. The geriatric patient also has a decreased thirst mechanism, so they will forget to drink water. Okay, they won't feel thirsty until it's too late. Okay, we talked about physical hazards, motor vehicle accidents. You all mentioned that in a very good way. Poison. So when we think about poisons, and one of the things I'm going to put into the classroom is going to be antidotes. Excuse me. Antidotes, you probably learned this in pharmacology, but antidotes is something that's important for you to know. I was working with the graduates last night and we were talking about magnesium toxicity, and the antidote for that is calcium gluconate. That is something you definitely need to know, right? When we talk about certain medications and their antidotes. So I'll put that into the classroom so you can have that as a reference. Poison control. That number, I remember when my daughter was a toddler, it was posted on the refrigerator because I was like, in case I need it. So what is the nurse's role for poison? Excuse me, educating parents of babies and toddlers. Get down on your hands and knees to look around and to get the view from their perspective. Those Tide Pods look like candy, right? So those kinds of things when we talk about poison. Okay. Excuse me. All right, falls. You all did a great job talking about falls and fire. The one thing I want to mention about falls, and I'm sorry I did not give you guys a break. I'm going to take a break after this. Falls is when we have a fall, that's probably one of the worst things that you could have happen to your patient. You want to always assess them first and see what's going on with the patient, and if they hit their head, because they could have a bleed on the brain. We have to do neurovascular assessments very frequently, depending on what has happened. It might be every 15 minutes, every 30 minutes. but very frequently, at least for 24, 48 hours. Okay. Okay. I have 6:50 my time. Let's take a 10-minute break and come back at 7.
I'm here.
Okay. Okay, good, Micaiah. Okay, here you go.
Okay, case study. Mr. Gonzalez is a 68-year-old man who has lived alone in a senior apartment building since his wife died 6 months ago. He and his wife were born in Mexico, but came to live in the United States shortly after they were married. He is retired from the he is retired from the produce warehouse where he worked for 37 years. They have raised 3 sons. The closest son, Carlos, is 30 minutes away by car. Carlos visits Mr. Gonzalez every week to socialize and take him shopping.
Okay, awesome. Thank you, Micaiah. All right,
You're welcome.
somebody else. Thank you. Somebody else who didn't read it. Tell me, what do you think? What is your initial impression about Mr. Gonzalez?
He's going through role identification.
Okay, what do you mean, Shatavia?
He's been working majority of his life and now he isn't. And he's kind of like, I'm not gonna say confined, but he's in a sense confined. And he almost is kind of like, okay, I'm not doing what I used to anymore, but he still has his son to come and visit him. So I kind of feel like he's going through that change of, this is what I'm used to. Now I got to get to this new reality of, now I'm here and my son is just visiting me and taking me out to keep me, just up and part of life.
Okay, awesome. What about the passing of his wife?
Yeah, he probably fallen into a depression.
Okay, so that could be something to look out for, right?
Right.
Okay, all right. So great thoughts. And so you all are thinking critically. Okay, very good. So that's one of our kind of scenarios. Whenever you see a scenario, I want you to break it down. And you may not necessarily, do it in a group, maybe do it with your friends, do it by yourself, but really break that scenario down. So you identified that he could have possible depression, the fact that he's born in Mexico, there's going to be some cultural considerations with that as well, because they may mourn differently the passing of a spouse. Then the family interaction is also going to be maybe a little different from, a typical American household, because they're a traditional Mexican household. We do have a son that is close by that does visit, so that's also good as well. So we know that at least somebody is caring for him. Okay. Okay, awesome. All right, so always break those things, those scenarios down. That's a great way to improve your critical thinking every time. Okay, so here's a question. Let's see. Let's go to Brianna to read this for us, please.
Okay. While caring for a child, you identify that additional safety teaching is needed when a young and inexperienced mother states that A, teenagers need to practice safe sex, B, a 3-year-old can safely sit in the front seat of the car, C, children need to wear safety equipment when bike riding, D, children need to learn to swim even if they do not have a pool.
Okay,
Definitely B.
okay, definitely B. Okay, yes. Okay, so yes, and so we know that children don't come with instruction manuals, right? But we know that this 3-year-old needs to be in the back seat, right? And I think you all said until 12 years of age, right? They need to be in the rear seat. Okay, awesome. Okay. All right. This picture in this slide just gives you the different types of seating arrangements. Okay, the ways that the car seats can be put in, the different kinds of car seats and booster seats. Okay, all right. So individual risk factors, we think about things that place patients at risk for different illnesses or situations. So it could be lifestyle. Maybe someone has a sedentary lifestyle that increases their risk for heart disease, diabetes, obesity. If a patient has impaired mobility, that increases the risk for DVTs, respiratory conditions like pneumonia, atelectasis, right? If the patient has sensory or communication impairment, they may have issues with their vision or their hearing that can make them an increased risk for falls. Right? So those are the kinds of things we're talking about. Economic resources, maybe they don't have the financial means to get all of their medications. That could affect them. Excuse me, lack of safety awareness. They may have cognitive issues where they may not understand that this is something that's not safe, right? So as nurses, we need to be able to recognize that, okay? All right, we have another case study. So let's kind of break this case study apart. Let's go to Shaitavia to read this one, please.
Jelani Green, a 25-year-old married mother of two, is currently a nursing student at the local college. As part of the clinical environment, she and her study partner are conducting health screenings and providing health promotion and education for the residents of apartments where Mr. Gonzalez lives. Part of Jelani's screening will include Mr. Gonzalez's home environment.
Okay, thank you, Shaitavia. So what are some of the things, if you were Joanni, that you'd be looking for? Anybody?
A clean space.
Okay, clean space. Now, clean is relative, okay? Because what may be clean to you may not be clean to the next person. So give me a little bit more detail.
Well, I mean, without like clutter, so she's not like a
Okay.
fall hazard or anything. To make sure she doesn't trip or hit anything.
Okay, yeah, so that's good, right? Absolutely. So clutter-free, because that could be an issue, especially with your geriatric patients. Okay, very good, Shatavia. Somebody else. What is Joanni
Maybe language barriers too. Maybe.
Yes, okay. Language, that's excellent. Okay, nice. Okay, very good. Okay, we're gonna continue. All right, so medical errors. If there's medical errors, we have to make sure that we're speaking up. If there is a medication error, the first thing that we're gonna do as a nurse is to assess the patient. Okay, and we never write the incident report and put it inside the patient's medical record. Okay, if there's an incident, we fill out an incident report, but it doesn't go in the patient's medical record. Okay, let's continue on. Okay, accidents. So if there's an accident, like a fall, a procedural situation that was an accident, some equipment malfunction, we want to make sure that we report it. Okay, if you get injured, make sure you report it, because your injury may not be bad at this moment, but 2 years down the line, now you have, spinal cord issues because of something that happened on your job. So make sure that you are reporting everything and documenting everything. Okay. Critical thinking, that's what one of the chapters is on, critical thinking. And that is just getting all the information, putting it together and making sense of it. Okay, and does this make sense? Based on this information, what am I going to do for my patient? What do I expect the doctor is going to order for my patient based on this assessment? Okay, so this is really important. And when we say critical thinking, you can't be a nurse without critically thinking. Okay, and it's always going on. All right, the nursing process, this, I'm gonna go over it very quickly because we actually have 5 chapters in the next class that's gonna go into each of these in a lot of detail. Okay, if I say ADPI, who does not know what that means?
Say that again, Ms. Ignacio.
ADPI, does everybody know what ADPI means?
Oh, I learned that in health assessment, but I forgot.
Yeah, what is it? Because we did hear that in health assessment.
Okay, so definitely this is something you have to remember, and thank you for letting me know that. So ADPI is the nursing process. This is how we apply our nursing care. Everything that we do is based off of ADPI. Assessment. So the assessment information is what the patient tells us, that's subjective, and then what we observe is objective. We get information through health history and physical, but this is your assessment, okay? So when we're always assessing the patient as soon as they come in front of us, or when we go into their environment, we're always making the assessments. Okay, when I was in nursing school, and I will tell you, I would start assessing the cashier's veins when I would be checking out, like, at the supermarket or something. I'm like, okay, I'm assessing their veins. Like, I was always doing it. And even at church one day, I was telling my husband, I was like, oh my gosh, this person has some really great veins. And he's like, we're at church. But it was one of those things that as a nurse, you're always assessing. Okay, so that is the A in ADPI. Any questions about that? Okay, and I think other nurses do it too, but I'm not afraid to say that, I'm weird in that way because it's just like one of those things. So nursing diagnosis, that is the D in ADPI. Okay, nursing diagnosis is how the patient responds to their illness. Nursing diagnosis is not a medical diagnosis. If your patient has a medical diagnosis of asthma, the nursing diagnosis could be ineffective airway exchange. So you all have a nursing diagnosis book, right?
Yes.
Yes.
Yes. Okay.
Yes, yes.
And you're probably like, what is this book for? Is it just a paperweight? No, it's actually an important book that sometimes your clinical instructor will be the one to have you pull it out. Excuse me. But the nursing diagnosis is not something that you make up. They actually every 2 years will get updated nursing diagnosis. Okay. And we may talk about nursing diagnosis in greater detail. So you'll definitely talk about that in clinical. Who's your clinical instructor going to be?
Miss Nicole Cuffy.
Yeah, that's what it says,
Okay.
Nicole.
Okay, Miss Cuffy. Okay, great. So I'll make sure I touch base with her to make sure she knows, but what we're doing in class. But definitely for clinicals, you would expect that you're going to write nursing diagnosis, and they have 3 parts. So, but that's going to be something we talk about more next time. But these are examples of the nursing diagnosis. Again, this is the D in ADPI, and when we think NANDA, they actually come up with a nursing diagnosis and they update it every 2 years. Okay. All right. So let me skip this. The P in ADPI is planning. Excuse me, based on what is going on with my patient, right? I'm going to plan some things. So for Mr. Gonzalez, I might plan maybe to get him out into some social groups so he's not, isolated, because it seems like the only time he goes out is when his son comes, and that's once a week, right? So I'm going to plan some things for my patient. If your patient has issues with that ineffective airway, I'm going to plan to get them some medication that's been ordered by the doctor. I'm going to plan to teach them about their triggers, right? So I'm going to plan all of these things, set up the priorities. What's the most important thing to do for this patient? Maybe I have to get help. Maybe I need a respiratory therapist, right? So those are all things when it comes to the P in ADPI, okay? The I is going to be implementation or intervention. Now, all of these things that I planned, I actually have to do. Okay. So I actually have to do what I planned. Okay. And this is a lot of times hands on with your patient. And whenever you teach your patient something, always get a return demonstration or a teach back. You have to visually see that, okay, yes, Mrs. Smith knows how to administer insulin. Mrs. Smith knows how to take her blood pressure, because when they leave your site, your facility, you want to make sure that they know what they're doing. So you actually have to see them physically do it. Okay. All right. So health promotion, developmental interventions also. Now, the last part of this is going to be evaluation. And I'm kind of skipping here. Evaluation. Were the goals met? My patient had an ineffective airway issue. Can they breathe now? How is their lung sounds, right? Did the family get their expectations met? Did our patient, Mr. Gonzalez, is he now no longer depressed? Is he socializing? Is he able to perform self-care, right? So we have to evaluate, okay? Those are the key things when we talk about ADPI. Okay, any questions about ADPI? Okay, that is like super duper important. You're gonna have to know that and you're gonna function by that. Your test questions are gonna be that way. NCLEX is gonna be that way. So it's really, really super duper important, okay? All right, so safety guidelines for nursing skills. Okay, you're gonna probably be able to do some things that you've maybe haven't done before. And your clinical instructor, they're gonna know, okay, you're a student nurse. It's okay to say, I'm a little nervous. Can you kind of help walking me through it or whatever the case may be, right? Because you don't want your patient to be harmed. Okay, even if you're a new nurse, because I remember when I was a new nurse, I had my preceptor and I'm like, oh my gosh, I haven't done this before. Can you kind of help me walk me through it so the next time I could do it on my own? And then she would just, stand there with me. Right, because when we were in nursing school, my instructors were like, look, you're operating under my license. I'm not going to let you do anything. So we didn't really get to do a lot. But that was the instructor's prerogative, right? But safety guidelines, you want to make sure that you're safe. If you're not sure, ask a question. Don't necessarily ask it in front of your patient. Pull your instructor to the side or the bedside nurse to the side and say, can you walk me through this? Can you help me? So I make sure that I'm keeping the patient safe. Any questions? Okay. Okay, awesome. All right, that ends this chapter. We're gonna now go to chapter 40, I think is the next one. And this one is shorter. This is hygiene. So let me ask you all what you know about hygiene. I'm gonna go around the room. And it could be anything. So we're gonna start with you, Erica. Hygiene. So, Erica, what do you know about hygiene with your patients? And I'm going to come around to everyone. Okay, Shaitavia, what do you know about hygiene?
Are I'm not going to say can't do it, but may have some type of disability or some type of issue that they're not able to do it on their own to perform, because if hygiene is not properly assessed and managed, then that can lead to infections, especially like in the mouth or the genital area, or of course if they have like an open wound or anything, that can also lead to infections too if they're not being properly cared for and hygiene standpoint, like taking a bath, making sure they brush their teeth and mouthwash and their bodies cleansed and they're not sitting in soiled linens or even a diaper forever. So yeah.
Okay, excellent. That was great. Okay, so it's a great summary. All right, let's see. Shantae, what do you want to add about hygiene?
Hygiene is very important so you won't get certain diseases. Maintaining the personal hygiene, it helps you prevent spreading diseases to other people and different things of that sort.
Okay, awesome. Okay, very good. Micaiah?
Sorry, someone's cutting the grass.
Okay, that's okay. Micaiah?
Assessing a patient's physical and cognitive ability to perform basic hygiene measures, that's really important. And it talks about that a lot in chapter 40. Also evaluating the hygiene procedures based on the outcome of the care and the patient's sense of comfort, relaxation, and well-being to understand the hygiene techniques. So making sure the patient understands why they need to have a good hygiene.
Okay, awesome. Okay, thank you. Madison?
I would say ditto on everybody else, but as far as like from a nursing perspective, just eliminating any chance of bacteria that can lead to like C. diff or sepsis is better than nothing. Washing your hands anytime you enter and exit a room eliminates that, cleaning your clothes. standard clinical uniform, stuff like that.
Okay. Very good. I like that you brought that up, Madison, about, standard clinical things and your uniform. So here's my plug to not walk around your house with your shoes, especially your nursing shoes that you've been in the hospital all day, right? A lot of times nurses will change their shoes, not maybe when they get to their car or when they get to their door, they have a station where they remove those shoes. Um, Yes, so I see, Erica. Okay, I wish you well. So yes, so that's going to be important. I recommend that you keep an extra pair of scrubs in your vehicle, in case of any accidents and patients spill bodily fluids on you. Yes, Micaiah.
I was just gonna add on, knowing also culturally their practices with their hygiene and making sure that they understand as far as their condition, what is important in considering their hygiene and how and what we need to make sure that the care is planned out and taken, just beneficial for them.
Yes, I love that point, Micaiah. So like cultural consideration. So when I was in the Navy, we went overseas, and one of the things that we learned is like not everyone shaves their armpits, right? For women, like that's really an American thing. So a lot of women have hairy armpits. Now that's, kind of becoming in style now for Americans because we're, in touch with our bodies and, it's my body, my choice. You can have hairy armpits, whatever, right? But that was something that was kind of, unique, like that I just thought everyone shaved their armpits, right? And so things like that will go a long way when you're caring for your patients to understand based on their culture, based on their religion, what's appropriate. Right now it's Ramadan, so there's a lot of cleansing that goes on and with your patients. So they may require a certain time, right, to perform the cleansing before you can actually, excuse me, go in and perform patient cares. Okay. So, okay, very good.
I think that was a good point too, because in my last clinicals at ECPI, we had a woman and she did not want to be bathed by a male. So it's important to know what your patient wants in that aspect too. So that was a really good point.
Yes, for sure. Now, and that is cultural competency, Madison. I'm glad you mentioned that because cultural competency is going to be important. NCLEX is going to test you on that. You need to know that your female Muslim patient is not going to want any male care providers. I've seen a lot of NCLEX questions around that. So if there's not a female, we better get a female because they're not going to accept a male. And in extreme cases, I have seen where a Muslim man did not want someone to perform CPR on his daughter unless it was a female, and his daughter ended up dying, right? I think she was saved from drowning. Now, that's an extreme case, but again, that's their cultural belief. That's what they believe. I have seen where Jehovah Witness refuse blood products, pack red blood cells, platelets, because they do not accept, right, blood products. So you got to know that about your patient. Okay. Okay, let me see. Who did I miss? Shantae, I don't think I heard from you. Hygiene.
I already said something a while
Oh,
ago.
you
Yeah, you
did.
called. Yes, you called me a
Okay.
while ago.
Okay, so it's Raven and Deborah. Okay, go
Yeah.
ahead, Raven.
So speaking to hygiene, so I will say that another important reason for to keep hygiene up is especially for people that's basically bed bound. And I say that because in some cases, and I've seen cases where it's been people that haven't been properly taken care of to where it basically their hygiene hasn't been taken care of because they're bed bound, and family or the nurses or whomever is taking care of them haven't been, didn't bathe them properly or was not bathing them as much as they should, and then their skin and stuff started to dry out, and the bed is smelly, the rooms and stuff started to get smelly. So it's really important that when you have people that are bed bound and they have to be cleansed, that you make sure that you would clean them as if you would clean yourself, and make sure that they're constantly clean on a regular basis and things like that.
Yes, that's an excellent point. So I'm going to share this with you. This is a kind of a horrific thing. At one of I did some clinicals with a school in Richmond, and the students uncovered the patient and found that the patient had maggots. Okay, so that when we talk about hygiene, and you're like, how could that happen in modern day? It happens, unfortunately, too often. Okay, so yes. Okay, thank you, Raven. Okay, Deborah. Okay, go ahead, Deborah.
Basically, hygiene, there's a lot of things that go with hygiene, especially when it comes to caring for patients, even with bedbound patients or patients that are in the hospital, basically teaching them how to properly care for themselves, even patients with dentures, teaching how them proper oral care, bathing. I even find that at my job, a lot of females that come in actually are more susceptible to like UTIs and urinary infections because they're not wiping properly. That's part of the teaching for the hygiene. As vaginal care, oral, like I said, oral bathing, and bacteria, decrease of bacteria, using separate washcloths for face and body. Like it's a lot that goes with and into the teaching of hygiene.
Yes, awesome. Okay, yeah, you hit a lot of great things. And that wiping from front to back is something that not everyone knows, and you're like, everybody should know that, right? For your females, but that's not everybody knows that. So that's really, really important. Okay, awesome. I think I've got to everybody. Did I miss anyone? All right, let's say again.
Sorry, I think you missed me, but everybody kind of hit everything.
Okay, who was that, Brianna?
Yes.
Oh, okay. Did you want to add anything, Brianna? I want to make sure you have a chance to add.
She's a good
No, I feel like everybody said everything. I mean, people have their own personal preference or social preference with hygiene.
Okay, well, that's a good point, Brianna, because we may be someone that, okay, you shower 3 times a day, right? But your patient
Yeah.
may
Only
not,
showers like once a week.
right? And that's like a thing now with Hollywood, right? They're saying, I guess Ashton Kutcher is one of those people like, hey, I don't shower all the time. And I'm like,
Yeah.
okay, well, hey, that's, that's your business, but we have to be able to care for our patients and meet them where they are and be non-judgmental too, but at the same time
Right.
educating them. So that's a great point. Okay, all right. I think we touched base with everyone. And one thing that's really important with hygiene, I want to make sure oral care, like that is super important. And in your patient that may be in a coma, your patient has a feeding tube, that oral care should be done at a minimum every 4 hours because that bacteria that's in the mouth, because everybody has millions of bacteria right in their mouth, like that's probably one of the dirtiest places on our bodies, the mouth. That bacteria can actually cause an infection in the heart. Okay, so that's really important. I know Deborah mentioned dentures and all of that. And one time I had a student that asked me a question, and it was a really good question because they didn't really know. If someone has dentures, do you have to clean their mouth? And absolutely you do. You remove the dentures, but you got to clean the gums because food can be stuck there. So I was grateful that that student asked that question because if you don't have dentures, you may not know. The other thing with oral care is brushing the tongue. Like, not everybody knows that you gotta brush the tongue. That is where the bacteria just hangs out and can really build up, right? So really, really important things. Okay. All right. So hygiene, impact of illness on hygiene. I'm going to tell you, if you ever had surgery or a procedure where you couldn't take a shower for a number of days or a certain period of time, that first shower is like heaven. When I had a C-section with my daughter and I had that first shower, it's like, oh, I'm human again. Woo! Right? So if you know that feeling, that's something that can help your patient improve. Their progress can improve, their condition can improve. Just by cleaning a patient's mouth before the breakfast trays come will encourage them to eat, right? Who wants to eat with funky breath? Like, who, tell me, who wants to do that? Right? So you have to really understand the importance of hygiene. Okay. Um, okay, let me see, excuse me, the skin, hands. Okay, let's talk about nails. All right, so I know that you all know for as nurses, we should not have long nails, we shouldn't have nail polish, no acrylics, all of that. Now, not just for us, but also our patients. Have you ever seen, I know some of you are working in a healthcare setting. In the 90s, I was a CNA in upstate New York when I was going to school. And there were some patients, um, excuse me, there were some patients that had dark things under their nails and they like to hold on to your arms, right? And those are the patients that would be scratching their bottoms and everything else, right? So, you know, when we talk about hygiene, like that's really important because we don't want that patient with those brown under their nails, those brown materials, which is usually fecal matter, right? Feeding themselves because then they're going to end up getting sick. So that's really, really important. It's a pretty gross thing, but I've seen it. And we want to make sure that we take care of our patients in that way. Okay, the hair.
Ignacio,
Yes.
quick question. So why is it that in nursing school we can't have nails, but out in the field you can? When once you're done with nursing school and you done graduated and you're out in the field, because there's so many nurses that have nails.
Yeah, well, I'm going to submit to you that those nurses are doing themselves a disservice and their patients a disservice because evidence base states that those acrylic, those overlays and everything actually is a breeding ground for bacteria. Okay, so I mean, I can't account. There's some nurses that come in smelling like, you know, sweet flowers and their hair's like Beyonce and they have on all this makeup, but it's really not safe for your patients. So here's an example. I had a healthcare provider when I was a young person in the military and they had really long nails. They were doing my OBGYN exam. You know, the part when they say, okay, I have to do a manual exam. That was very, very uncomfortable for me. Okay, so that's an example of like why we shouldn't have long nails as healthcare providers. You're going to see a lot of things when you get out there in the field. And I'm not saying that it's right, but you're going to have to make the decision on what to do and what's safe for you and your family. So I remember when I got out of the military, I was like, I'm going to dye my hair pink and I'm going to get cat claws and everything else. And then, of course, I became a nurse and I was like, I can't do that. Then I'm a nursing instructor. I definitely can't do that because it's not setting a good example. But, and you're going to find that facilities actually have the policies, whether or not they enforce it, that's something else. Okay, does that answer your question?
Yes, ma'am. Thank you.
Yes, you're welcome. And so I'm going to tell you, when you're out there in the field and you see these nurses with these long nails, take a peek underneath their nails. Take a peek. And I would tell you, if you're a nurse with long nails and if your nails are not clean and you're making food for your family, like that's the thing that really gets me thinking about it. I'm like, okay, I'm making a sandwich for my daughter and I have these long nails and I had a patient that had C. diff last night. Like that just doesn't give me a warm and fuzzy feeling. Okay, but anyhow, but that's a great question. All right. And we're just telling you what's the right thing. It's kind of like when your parents say, okay, I'm going to teach you the right thing. What you choose to do when you grow up is going to be up to you. So, all right. Factors that influence hygiene. Excuse me. social practices, personal preferences, body image. That's something, we talked about a lot of things, but not body image. What if the patient is depressed? What do you think that their hygiene will be like if they're depressed or if they have a poor body image?
Not very
Not
cleanly.
good. Yeah, it's gonna be not.
Yes. Mhm. When you take mental health, you're going to see that that's one of the signs of a major depressive patient. Besides, of course, looking out for suicide, they may have poor hygiene. They may not want to get out of bed. Their hair will be matted, right? All of that. Socioeconomic status, maybe they can't afford, certain things for hygiene. Health benefits and beliefs and motivation, and cultural variables. So we kind of touched on all of these things. So that's great. So developmental stage. So it's really important for us as nurses to know what is appropriate at particular developmental stages. So here's an example. So I was a preschool nurse at one time at my daughter's preschool, and they brought a boy over to me and they said, this boy is child abuse. Colleen, he's got all these bruises on his back and on his bottom. And I was like, oh my gosh. And I'm like, oh my gosh, I'm freaking out because I know we're mandatory reporters. I was like, okay, bring this boy, let me see what's going on. So they brought him to me and I looked and I said, these are Mongolian spots. These are not bruises. And so I kind of chuckled and I was like, well, you guys, they wouldn't know that because they're not nurses. And then I said, hey, these are what Mongolian spots are. They're usually, and let me ask, does anybody here, y'all took health assessment, so y'all should know what's Mongolian spots. Somebody tell me what's Mongolian spots.
I have no idea. We didn't learn that.
Oh no.
No, did not learn about Mongolian spots in health assessment.
Oh,
Yeah, I don't
they're
know
like,
what that is.
I think they're like a almost like, it kind of look like you have spots on your skin in a sense. They're non-pigment.
They actually are pigmented. Okay. All right, so let me bring up this. Okay, let's see. So Mongolian spots are more common in those that are of dark skin. So here, this is kind of what it looks like. Okay, so here's a good, and it's usually on the back, it's usually like by the bottom. And so this is like a lot of Mongolian spots, but that could be a normal finding. Like, it's not clinically significant. It doesn't mean that they have cancer or that they're abused or anything. A lot of time this pigmentation will go away as they get older. Okay, so when I bring up this example of what is appropriate for the patient's age, developmental status, their ethnicity, they brought this boy to me and they were freaking out because they're like, oh my gosh, he's got all these bruises all over his body, but he had Mongolian spots. Okay, and so that's something that you should probably know. And again, it's more common in those of higher melanin. Okay, Mongolian spots. And I don't know, these other pictures are kind of weird, but this is the true Mongolian spots. I challenge you to go back and look at your health assessment book and see if you have this. I think you all might have Jarvis still, so you may have this, but that's Mongolian spots. Okay. All right. Continuing on. I'm still sharing my screen. You should see critical thinking, one of two, when performing hygiene care. Okay, so let's talk about this because this is fundamentals. One of the things nursing students may say sometimes is, I don't want to do CNA work. Well, all of it is nursing work because if I am performing hygiene care on my patient, I am assessing them at the same time. If I am toileting my patient, I am assessing their gait. I am assessing their urine. I'm assessing their stool because I can find out so much from my patient's health during this time, right, with them. I can look at their range of motion. I can look at their level of consciousness. There's so much that you can do when you're performing hygiene care. So never be the nurse to say, oh, that's CNA work. Anything that is involving caring for the patient is our job. Okay, as a bedside nurse, I was not above emptying the trash, especially if it was like a diaper that smelled really bad. I don't want the patient and their family to be in there with a dirty diaper that smells really bad. If the laundry bin is overflowing, I can back it up just like anyone else. Right? Because if you do that, your team is going to be so appreciative of you and they're going to respect you. As nurses, we have to be the leaders, right? As registered nurses, we have to be the leaders and we have to set a good example. Okay, so please, and I'm not saying you should do all the trash and no, you can't necessarily do all of that, but don't be the nurse that says, oh, I can't do that. It's above me. Okay. All right, so critical thinking, whenever you're caring for your patient, you're going to be using that critical thinking. Okay, this is a chart that's showing you ADPI. Again, you see the ADPI, you're not going to get rid of ADPI, so please commit it to memory. So this is important when we think about assessment, again, diagnosis, planning, implementation, and evaluation. We want to make sure that we don't put our biases into caring for a patient or judging the patient. Okay, that's going to be important. I'm not going to belabor this because we have many chapters that's going to go into ADPI in real detail. All right, when we are assessing our patient, okay, so here's the nursing process. Through the patient's eyes, what is the patient telling you? Again, that is subjective information. How can the patient perform any self-care? Even if the patient had a stroke, if they've got one good hand, put a washcloth in that good hand. They can wash their own face because that empowers them that they're participating in their own care. Okay, so we're going to assess. Okay, assess the skin, the feet, the nails, the oral cavity, hair, eyes, nose. Do they have any sensory aids, glasses, hearing aids? Make sure that those things are labeled and not balled up in tissue. You don't want to break your patient's dentures. That's going to be important. So putting a washcloth at the bottom of the sink is going to be important in case the dentures fall. Here's a story. Patient was going for a procedure and apparently they didn't remove his partial plate. And I'm going to bring this to you. Patient swallows. So he had his procedure where he was intubated and and he was released and then he was sent home. He went to the emergency room. He was like, man, I just can't breathe well. So they sent him away. They said, oh, you just have a cold. Here's some cough medicine. He went back to the emergency room a couple days later. They did an x-ray. They found his partial plate was stuck in his throat. When they gave him, when they intubated him, they knocked that partial plate down his throat and it was stuck in his throat. So I'm sharing that picture right now. You should see. Okay, so let me ask you this. Did somebody miss something?
I would say yes.
Yes, absolutely yes. So
Absolutely.
yes, right? And so this could be causing the difference between life and death for this patient. I'm really surprised that he lived for this long with that partial plate stuck in his throat and that he wasn't hemorrhaging, right? So somebody missed something, and that could have been the nurse, it could have been the CNA, but they didn't realize that this patient had a partial plate. Okay, the patient himself was an older patient. I think he was like 68 or something. So he, he probably didn't even remember. But again, that's important. We have to pay attention to those things with our patients. Okay. All right. So patients may have lack of knowledge. They may not understand the side effects of their medication. They may not be able to perform hygiene. And they may have a condition that causes them to have injuries. So for your chemotherapy patients, they may be losing their hair. If they have radiation, their skin is at risk for damage, so they can't be out in the sun, right? So we have to understand how their medical condition can influence their health and overall condition. Okay. All right. Now, when we think about a nursing process, we're going to continue. When we think about the nursing diagnosis, that's your D in ADPI. Activity intolerance, meaning the patient can't tolerate maybe just walking to the bathroom. Maybe they can't tolerate walking around the block. We have to look at that. Impaired mobility, maybe they are a stroke survivor, right? And maybe they have left-sided or right-sided weakness. Impaired health maintenance, maybe they can't reach certain places because of limited mobility, or they don't have the resources to maintain their health. Impaired skin integrity, a lot of times that happens with your geriatric patients because as we age, we lose that subcutaneous layer of skin, right? And low self-esteem. Okay. Again, we talked about that with your depressed patients or patients that have body image disturbance issues. So when we plan, we want to set up outcomes, setting the priorities. You always want to prioritize teamwork and collaboration. When we talk about prioritization, what does that look like? I'm going to ask you, when I say prioritizing, what does that make you think of?
What is the most important?
Excellent. I love that. Yes. What is the most important? If I could do one thing and I had to leave, what would that one thing be? Okay. And that's going to be good for you. If you understand that, you're going to get these prioritization questions correct. Okay. Awesome. So that was well said. Was that Brianna?
That's Madison.
Madison. Okay. All right. Very good, Madison. All right. Okay. Nursing process. Okay. Again, we saw that before. Okay. So in your skills lab, I'm excited for you all because you're going to be learning how to give bed baths. And so this is something, if you want to practice at home with your family, go right ahead. Um, so bed bath, that's really going to be, excuse me, really an important skill. And it's going to help your patient, especially if they're bed bound, just getting that dead skin off and feeling clean, smelling fresh. That can do so much to help your patient. Okay. But you're going to be getting all of these skills. And what I can do, if you all want, I can put some really good videos in to kind of get you ready. So when you get to lab, you'll be ready to rock and roll. Let me just write this down. Okay. Okay. Because there's certain ways that we have to do certain things. So I'll make sure that I put that into the classroom as a follow-up. And Nicole Cuffey is your clinical instructor. Who is your skills lab instructor?
The schedules are saying different things because at one point mine says Miss Martinez, but I don't think the dean is going to be the instructor. Then I also have Mr. Cadet.
I have
I just have
Mitchell
Miss
Boyd.
Martinez. I just have Miss Martinez, but from what they're saying, it's going to be switched from what they told me yesterday. So I really don't know.
Okay. Now, I know that Dean Martinez is doing some classes, but I'm not exactly sure which ones. So, but okay, that sounds good. So I just wanted to know
Miss
because
Ignacio,
yes.
Miss Ignacio, I reached out to Miss Forrest today because I wanted to find out about the Tuesday Sims class at 8 o'clock at night until 10:30, and that was just for Sims. But I was asking her why it was so late on a Tuesday when I have class on Monday, Wednesday, Thursday, and Saturday. And she basically responded and was like, they have so many students that they were just trying to break the students up in because they couldn't have but so many students in one class. That's why they're breaking it up like that.
Well, yeah,
Yes.
that's true, Deborah. But when I talked to them as well, for our class, they said it was broke up like that because I asked about 8 o'clock class too. And they said that it's supposed to be changing from what they told me when I went to school yesterday. So I don't know what is changing to or what's going to be what, but that's what they said.
Yes,
Okay.
and that is true. And that's something I think we mentioned earlier in the class that they are making some schedule changes. So it should be posted tomorrow. So keep your eyes open. But
Okay.
yes. So yes, and I know and I'm always going to ask you who's your instructor because I want to make sure that I coordinate closely with them.
Saturday.
Okay. So but yes, okay. Okay, let's take a look here. I'm still sharing. You should see nursing process 8 of 12, oral hygiene, brushing, flossing. a patient with special needs. Excuse me. So that's something to consider. And when you go into your skills lab, you're going to be learning how to care for the patient, oral care for the patient that is unconscious. One of the big things is putting them on their side and having suction close by because we don't want them to aspirate. We want to protect their airway. When you're shaving a patient, you're going to shave with the grain. You're not going to go, excuse me, against the grain. That's an important point to note. And also, this is another thing that test questions are made of. If your patient is on blood thinners, like your heparin, your warfarin, even a baby aspirin, they're at increased risk for bleeding. They shouldn't be using a straight edge razor. They should use an electric razor. Okay, those are the kinds of things that we have to kind of think about because you're like, oh, just shaving, that's not a big deal. But it could be a big deal for that patient that's on blood thinners. Okay. All right, any questions about that? Okay, so medical devices, the hearing aid, I've seen a lot of questions on the hearing aid. Make sure that we take it out. You have to clean it because sometimes there could be cerumen that's packed on it. Take it out, clean it, put it in a container at night, and make sure it has a label with the patient's label. Turn it off so they're not wearing out their battery. If the patient has a lot of feedback in their hearing aid, they need to let the doctor know because maybe something is not quite right with their hearing aid. Okay, but never ball it up and put it into tissue. Always make sure the patient's assistive devices, their glasses, their hearing aid, their dentures are close by. A lot of the falls are patients that are reaching for their personal possessions. So make sure that that's close by. Okay, eye care, this is important. You always wipe from the inner canthus to the outer canthus. Can anybody explain that to me? What does that mean?
Thing within the eye, you're not putting it more within the eye by wiping in the inside of it.
Okay, yes. So you're right, Shaitavia. So by the bridge of your nose, that's the inner canthus. The outer canthus is the edges that are closer to your ears. In the inner canthus, we have these ducts. So if you wipe any dirt or materials to the inner canthus, you can actually plug those ducts. And that can cause infection. Those plug ducts can become inflamed, and it's not good for your patient. So you always want to wipe from the inner canthus to the outer canthus. Use a separate cloth or tissue when you're wiping each eye, because what if the patient has pink eye in the left eye? Now we contaminated the other eye. So we always want to use separate tissues or cloths when we're talking about cleaning the eyes. Contact lenses, always wash hands. And whenever you're doing something with somebody's eyes, never use hand sanitizer. Always wash your hands with soap and water. Still wear gloves, but that hand sanitizer can burn the eyes. Okay. All right. So let's see. Patient's room, we talked about that. And you're going to be doing this in your skills. What's something you notice about this nurse?
She's holding it away from her uniform so she doesn't contract anything.
Yes, excellent. So she does not contaminate herself. That's how you want to do it. Okay, never shake the linens, okay? Because there's a lot of stuff in those linens. Please don't shake the linens, okay? Yes, don't shake the linens. I'm just laughing because I remember in nursing school, sometimes you hear your nursing instructor's voices in your head, and she'd be like, "Don't shake the linens. All that stuff is gonna jump out at you." So, but I just hear Dr. Barron's voice. So in skills lab, you're going to be practicing that, how to do it safely, but hold it away from you. Don't put it on the floor. Put it immediately into the dirty bin, because now this is contaminated, C. diff linens. You put it on the floor. Now my shoes, I step on that floor, I take those shoes into my house. Okay, now my baby is sick because of that, right? So we want to handle things properly. All right, evaluation, again, that's the last step of the nursing process. And the nursing process is continuous, okay? It's continuous. We're never really done, okay? We're never really done. We're always using the nursing process to care for our patient. What you're going to be practicing in lab when you're performing hygiene for your patient, you're going to go to the, you're going to move from the cleanest to the dirty areas. Excuse me. So what does that mean? I'm not going to start with the patient's peri area. Okay, that's not where I'm going to start, because that's, especially if they're incontinent, that's probably going to be one of the last areas that I do, right? The feet, one of the last areas that we do. When you are caring and performing hygiene care for your patient, long, firm strokes, okay, distal to proximal, far away to the core of the body, because you're promoting blood flow back to the heart. So if you have your left hand, put it on the fingertips of your right hand, and then bring that left hand up your arm all the way to your neck. Long strokes like that. Okay, distal, which is distant to proximal, because you want to promote blood flow. So again, that's why giving your patient hygiene care is not necessarily CNA work, because you are actually promoting blood flow, assessing the patient's capillary refill, assessing their circulation. You're doing all of your assessments. If they have any nerve damage and if they have any skin breakdown, that's going to be what you do during that time. Okay. Always, always, always wear PPE. Okay, that's going to be important. Okay. And the temperature of the water, we are testing with our wrist, right? That's going to be a good kind of way, because sometimes our hands may be less sensitive to the heat. So testing with your wrist is a good idea. Personal hygiene standards or items with the patient's reach, we've mentioned that already. If you have someone that you're delegating to, your AP is your assisted personnel, make sure that you give them proper instructions. Don't assume that they know what they're doing. Ask them, and if they need help or if they need a demonstration, then be willing to help and demonstrate with them. Okay, one of the good things that you can do as a nurse is, if your AP is going in, go in with them, because especially if that patient is a 2 assist, then you can assess their back, you can assess their wound, you can do wound care at that time when you have somebody in there with you. Okay, I'm going to stop here and see if there's any questions about hygiene.
No, ma'am, not for me.
Okay. Okay, the next thing that we're going to do is we're going to talk about the chain of infection, but we're going to play a Kahoot, because I want to see what you know about the chain of infection. So let me get my Kahoot ready to go. And it's okay if you're not familiar with Kahoot. I will explain it to you. Kahoot is a game of speed and accuracy. It's a fun game. And it's going to ask you questions about the topic at hand. And this time it is going to be the chain of infection. Okay, let me see here. Oh, wait, I had my Kahoot. Oh man, I had too many tabs. All right, let me log back in. All right, does anybody not know how to play Kahoot? Okay, let's see. Okay, then everybody knows. Okay, perfect. Okay. All right, chain of infection. Okay, here we go. Okay, let me share my screen. All right, we're gonna play in classic mode. Okay, let me see here. I'm sharing my screen, and let me put the link in the chat. Okay, so you all should see the pin and you should be able to join. And I always stop after the first question to see if there's any technical issues or if anybody has any questions. And if you, excuse me, haven't played Kahoot before, on my screen that I'm sharing, you're going to see the questions and the answers. On your screen, on your device, you're only going to see the colors and the shapes. Okay, so you have to kind of look between my screen and your screen. So this is a game of speed and accuracy. This one only has 10 questions. And this, I know that I promised you guys a pop-up quiz. And so this will kind of be, oh, sorry. This will kind of be our pop-up quiz to see if you all came ready and if you know about the chain of infection. All right, let me see who do we have. We have Brianna, she's there. Deborah's there. Maddie is there. Okay. Micaiah, I don't see you. Shantae, I see you. Okay, so SM, that must be Shatavia. Okay. 1, 2, 3, 4, 5, 6. So we should, okay. Okay, 7. Okay, so this is everybody. Okay, perfect. Okay, good luck. Chain of infection. Which link is broken when the CNA washes her hands after leaving a patient's room? Etiological agent, reservoir, portal of exit, or mode of transmission? Okay, so we got some of a little bit of everything. So mode of transmission. So I have a feeling not everybody knows all the links to the chain, but that's okay. All right, when autoclaving infected surgical instruments, which link of the chain of infection is broken? Susceptible host, reservoir, etiological agent, or mode of transmission? Okay, somebody got it right. Okay. Okie dokie. Okay, I see you, Raven. All right. A chickenpox vaccine, when is administered to a pediatric client, breaking what link of the chain? Etiological agent, reservoir, portal of entry, susceptible host. Excuse me. So susceptible host. Oh wow, we're kind of all over the place with this one. Okay. Okay, SM is in the lead. What link is broken when an infectious and draining wound is bandaged? Portal of entry, portal of exit, reservoir, or susceptible host? Okay, we got some work to do on this one. Okay, question number 5. Do not recap a needle, but put in a sharps container. What link is broken in this chain? Reservoir, etiological agent, portal of entry, susceptible host. let's see. I don't know about that question. Okay. All right, let's continue on here. Placing a mask on a patient with TB will break what infection link? Portal of entry, portal of exit, susceptible host, or reservoir? I was hoping more of you would get that portal of exit, okay? Because we don't want the patient coughing, spreading their TB everywhere. Okay, just like you guys don't want me coughing on you right now. Eliminating standing water in areas prone to mosquito population break what link? Susceptible host, etiological agent, reservoir, or mode of transmission? Reservoir, somebody got it. Okay, what's that? Okay, good job. The health assistant performs skincare to avoid breakdown. What link is targeted? Causative agent, portal of entry, susceptible host, or reservoir? Okay, portal of entry, because your skin is your first defense against injury and infection, right? So your skin is your first line of defense. Okay, all right. Infectious waste is placed in biohazard bags for later incineration. What link is broken? Reservoir, etiological agent, portal of exit, susceptible host.
I can't answer these questions. Even though I know the answer, I can't click on nothing. I don't know why.
Oh, you had some technical issues?
Yes, I am. I can't. I've been trying to click the whole time and I can't get it.
Oh,
It won't let me.
no. Okay, so I'm sorry for that. So if you ever have any issues, you can always put your answers in the chat. Cause
Okay.
yeah, so I'll see them and I'll know that okay, at least you're answering them. But that does
Okay.
happen
Yeah, because
sometimes.
I was like, where in the world I can't click it?
Sometimes that happens. Sometimes like the internet could be slow. So that
Okay.
happens too. I would say
Okay.
sometimes if the weather is bad, but it seems like it was a bright sunny day today. So but that happens. Our last question. Refrigerating food properly breaks what link in the cycle of infection? Reservoir, etiological agent, portal of exit, mode of transmission. Okay, reservoir. Okay. All right, so we've got some work to do. Okay, I saw your answer, Deborah. Thank you. Okay. That's a cute emoji. Okay, in third place is Raven, and second place, I think that's Shytavia, and in first place is Madison. Okay, runners up are Brianna and Micaiah. Okay, so not too shabby, but we've got some work to do on this
Yeah,
chain
sure.
of infection. Okay, so let me just close this up, and excuse me. This chain of infection is kind of like our bread and butter when we talk about keeping our patients safe. And when we think about Florence Nightingale, this is like one of her big things in her claim to fame. Okay, it's just by keeping things clean, washing our hands, she was able to save lives. That was something we as a human race had to learn during COVID-19. We had forgotten how to wash our hands. We forgot simple, basic things. And I say as a human race. And I'm going to tell you, what was it like last month? My daughter and I, we were in a public restroom, and we both stood there as a lady left out of the bathroom stall and didn't wash her hands. My daughter looked at me, I looked at her, and she was like, "Mom." And I was like, "Yeah." Like, oh my gosh, she did not wash her hands. And then the funny thing is, she was in the lobby of this place where we were, and she was in the food line. And I was like, oh my gosh, that is so gross. So it was just funny. My daughter and I, we just looked at each other and we knew that. But again, that's something that as nurses we have to, reinforce and teach our patients, because that is not common knowledge for everyone. I know it may seem shocking, but it's true. All right, let's jump right in. Infection control. All right, so chapter 28. So one of the things that you can do, depending on how you study, you can have your PowerPoint, or you can have your textbook, or you can have both. And when we think about infection, we think about these pathogens, disease-causing organisms. And we think of pathogens being bacteria, viruses, protozoa, helminths. Okay, so those are different things that can cause infection in us, in our patients. When we think colonization, I think you all took microbiology. Hopefully you had a chance to grow your own bacteria. Did you all have a chance to do that?
Yes.
Okay, awesome. That's always like my fun thing to do, because I've done that with my daughter a lot of times, because I do homeschool. And so that's one of the things that we do every now and then. We grow our own bacteria. And we did it because we did a human anatomy last term, last semester. And so each of the students, I think they had a chance to grow three different bacteria. No, I think they got two chances. So some of the boys in the class, they did the toilet, somebody did the doorknob, somebody did the shoe. So what does my daughter choose? My nose. So I'm just like, oh my goodness. And so it was really amazing to see, because we let the bacteria grow for a week. So it was really amazing to see what ended up being the worst. And the doorknob was actually had the most different colonies of bacteria, which was not surprising, but it was quite disgusting indeed. All right. And then we think about infectious diseases, right? They have a specialty in nursing. If you want to be an infectious disease nurse, that's a total field. All right. So this is what we were talking about in this Kahoot quiz. This is what you have to know. Okay. So some of you, I could tell, really were not familiar or maybe didn't understand the terms, but it's okay because we're going to talk about it now. So we have this infectious agent. Okay, so right now I am an infectious agent with COVID, right? So so when we think about it, I'm the one that will be contaminating people, right? But I won't, so I'm isolating myself, but excuse me, I have the potential to do that. Okay, so well, the infectious agent is the COVID virus, actually, and I'm the reservoir. So COVID is just hanging out in me right now. Portal of exit, when I cough, sneeze, laugh, that's where I'm actually letting all of that come out, right? So that's why in that other PowerPoint, it had the patient that had TB, and we put a mask on them, because if they're coughing, we want to contain that portal of exit. Right. That was a question from the Kahoot, I mean. Excuse me. The mode of transmission. How is it transmitted from a person to a person? Is it on something like a pen that could be considered a fomite? Is it equipment that hasn't properly been sterilized? Is it maybe I cough into my hand and then I shake someone's hand, right? How is this transmitted? Now, the portal of entry is how does it enter that person? So if I see you and I have COVID, I cough in my hand, I shake your hand, you rub your eye, now it has entered your eye, right? That is a portal of entry. Now you are a host to this virus or this infectious agent, okay? So in order to break this cycle of infection, we need to break this link. Any one of these areas can be where we break the link so we don't transmit this infectious agent. And the Kahoot was calling it an etiological agent, but it's the same thing. Okay, so any questions about this kind of chain of infection? Okay, because this is a very important concept to grasp. Okay, so let's talk about the infectious process. So defenses, well, we know the skin is the first line of defense against injury and infection. We have our immune system. We know that inflammation is the body actually saying, hey, I'm protecting itself. So if a patient has a fever, that should tell you that there's some infection there. Okay, if the patient has exudate that is malodoriferous, meaning that it smells bad, that is a sign of infection. If the patient has urine and it has sediment in it, that's a sign of infection. Okay, so we need to know what signs of infection are. Those are the clinical cues that we talk about with next generation. Hospital or healthcare associated infections. We don't want the patient to get an infection because of us on our watch. How could that happen? If I don't observe sterile technique when inserting a Foley catheter, right? If I am inserting the Foley catheter and I realize, whoa, I'm not in the urinary meatus, I'm in the vagina, and then I take it out and then I stick it into the urinary meatus. Now I'm going to give my patient a UTI. The proper thing to do is, okay, it's in the vagina, leave that tubing in and get another kit and go above that because you know that's not the correct opening, right? And then once you get your flash of urine, you remove the one that's no longer needed. Okay, but healthcare associated infections can also be very expensive for hospitals because of our negligence or because we didn't do the right thing, now the patient has this infection. The thing that could be very concerning is your patients could be immune compromised and they may not be able to survive a hospital or healthcare associated infection. Okay, so again, with invasive procedures, make sure that we're utilizing the proper sterile technique, aseptic technique. If we're administering antibiotics, make sure that we're doing that also the right way. And then there are some organisms that are resistant to treatment. Okay, and those are your MDROs. Okay, breaks in infection prevention and control activities. And again, hand washing is one of the best ways, excuse me, that you can prevent this chain from continuing. Okay, so factors that influence prevention and control: age. Okay, so have you ever seen a toddler and they will just lick shoes? Like they will put anything in their mouth, right? They just don't know better. So that's what we're talking about. That's just an example. Sex or gender, right? Male or female. What Deborah mentioned in the beginning, women are greater risk for UTIs because we have to know to wipe from front to back, wearing cotton underwear, getting our cranberries in. Also, we have shorter urethras than males. So we are at increased risk for UTIs. That's just, courtesy of Mother Nature. Nutritional status, that's going to affect your patients. If they have poor nutritional status, that decreases their immune system. Stress can alter your immune system. I think that's I think Shatavia mentioned that in the beginning of the class, right? And then disease process. That's something when COVID first came out, they said if you have other comorbidities, you're at increased risk. So that could be diabetes, asthma, hypertension, right? These are things that can affect your patient's health, okay? So the nursing process, look at this. It's everywhere. You can't get around it. Excuse me. So when we talk about this chain of infection, we're looking at it through the patient's eyes. Okay, what are the risk factors? How does the patient appear to us? What are the clinical cues? If that wound has a purulent discharge, I know that's an infection. right? What about self defense mechanisms? Sometimes patients can be in denial. Okay, so that could be something to look out for as well. Medical therapy, that could be your antibiotics, your ointments, triple antibiotic ointments, or IV antibiotic therapy. The travel history, that's big, right? Especially when we're talking about COVID, when we're talking about Ebola. Have you been to a foreign country? That's one of the things to think about, because in certain countries, there's certain things that are endemic. So I went on a deployment to Africa. One of the things that we're concerned about in Africa is malaria, dengue fever, those kinds of things. Okay, and then laboratory data is going to be the blood work. Okay, so this is all assessment. Remember, assessment, you're gathering information. Excuse me. So your D in ADPI is your nursing diagnosis. So the patient may be at risk for infection because their skin is compromised. Excuse me, or they can have impaired nutritional status. They're not taking in enough nutrients, or they can have impaired oral mucous membranes. And we talked about the infection or the bacteria in the mouth that can cause infections other places in the body, specifically the heart. Social isolation, that can increase their risk as well. Impaired tissue integrity. So these are all potential nursing diagnoses. So what are we going to plan to do for this patient? Well, proper hand hygiene, right? Florence Nightingale would be proud. Teach your patients how to perform hand hygiene prior to discharge. Looking at their wound, okay, looking at the patient's vital signs, they should be afebrile, because if they have a fever, that's a sign of a systemic infection. Okay, looking at the wound, that's going to be important. Letting the patient know, okay, if you have a fever when you go home, that's something to call the doctor about. Okay, so that's your planning. Implementation, we're actually going to do it. Excuse me. So nutrition, especially nutrition is important. Building up the immune system. If the patient has a wound, I want them to get enough protein, enough zinc, enough vitamin C, vitamin A, because that's all important for wound healing. Excuse me. Immunizations, we talked about with our immunizations of our geriatrics, also immunizations of our pediatrics, and immunizations across the board. Rest and regular exercise is going to be important, and acute care, we want to eliminate that infectious organism, whatever it is. If it's a fungus, we'll administer antifungal medications. If it's a bacteria, I would expect to administer antibiotics. Okay, so let's talk about medical asepsis. Can anybody tell me what medical asepsis is?
Is that an infection acquired by like a hospital?
Not exactly. Anybody else want to take a guess? So what about sterile technique? Do you all know anything about sterile technique?
That's basically when you clean the instruments and everything so they're free from the germs from transmission.
Yes, and I sound like Shatavia. So yes. So we want our equipment to be sterilized. That is correct, right? In the autoclave. So that's a part of it. So have you ever seen, maybe in movies, maybe in your job, that things will be set up, the instruments will be set up in like a blue kind of folded, it's not gauze, but it's like a paper after they come out of the machine being sterilized? Has anybody ever seen that? No, you probably haven't seen that. Okay. So that's one of the things that it looks like when it comes out of being sterilized, and it has to be, so that's why we can reuse these instruments. Okay, so have you ever been to the dentist and you see the stainless steel or the metal equipment that's used? Anybody been to the dentist and you've seen that? Okay, so they don't throw those away, right? They actually sterilize them. They have to be cleaned and properly sterilized to be used on the next patient. So that's one of the things that goes with this medical asepsis. We're talking about sterile technique. So when you are in skills lab, some of the things that you're going to learn, excuse me, when we talk about medical asepsis, is that 1 inch around the border of your sterile field is not sterile. Okay, you're going to learn about sterile procedures like Foley catheter insertion. NG tube insertion is not a sterile procedure, it is a clean procedure. You're going to learn how to safely put things inside of your sterile field. You're going to learn that if you drop your hands below your waist, you contaminated your sterile field. If you reach across your sterile field, you've contaminated your sterile field. So those are all, when we think about medical asepsis, in the surgical suite, everybody's hair is covered, their shoes are covered. If you have a beard, your beard is covered, right? That because we don't want anything to fall into the patient. That's why these false eyelashes, that could be an issue. There have been documented cases of false eyelashes falling into a patient's wound. Okay, I don't know about you, but I don't want a false eyelash in my wound. Like, no, thank you. Okay, so that's why we have these rules in place. Okay, granted, you're going to see deviations from that. I can't speak to that, but at least what we're, trying to instill in you is to keep yourself safe and your patients safe. Okay, so that's what we talk about when we're talking about medical asepsis. Okay, we don't want dirty equipment to be used on patients. That increases the risk of infection. And so controls of portal of exit or entry, cough etiquette. So cough etiquette, as I've been coughing all night, that's why I said, okay, I cannot have class because I would be coughing like on you, right? And that's not safe. So we know that we're teaching our children now to cough into their elbows, right? Because we're not coughing into our hands because we touch everything with our hands. And then of course, hand hygiene. Any questions about anything on this slide? Okay. All right. Isolation precautions. These are the things also that test questions are made of. What is the proper way to don and doff your equipment? What are the different transmission-based precautions? So if my patient has COVID, I need to know that, okay, I'm going to wear an N95. If my patient has tuberculosis, I'm going to wear an N95. The patient's going to wear a mask if they have to come out of the room. In the case of the tuberculosis, they're going to be in a negative pressurized room because we don't want their air, because TB is an airborne condition, right? We don't want that to be mixing with the air in the rest of the hospital. So that's going to be important for you to think about as a nurse, the different kinds of transmission-based precautions. And what does the patient have that's infectious and how is it spread? So sometimes you can have a patient that has MRSA. And it's like, okay, well, do they have MRSA of the skin of a wound? Is it in their urine? Is it in their nares? So we really want to know what kind of infectious agent it is so we can set up the proper transmission-based precautions. If you have a test question and the patient has something that is potentially infectious and communicable, one of the first things that you're going to do is probably put that patient in isolation. So here's an example. If your patient comes in with nuchal rigidity and they said that they have a headache, their neck hurts, what do you think they have? Anybody have any guesses?
Repeat the question, Dean. I'm sorry.
So if your patient comes in with nuchal rigidity, They say they have pain in their neck or they have a headache. They can't bend their neck. What do you think could be possibly going on with them? And they have a fever. And it's okay if you don't know this because this is a med surge kind of scenario.
Can you repeat it again? You said they have pain in their neck.
Yes, and they have nuchal rigidity, which means they have a hard time actually bending their neck.
Could it be something spinal related?
Yes, I like the way you're thinking, Deborah. Okay. You're on the right track. So what is the condition you think they may have? And y'all probably might not know this because this is really like a med surge, maybe even a med surge 2 kind of question. So I'm thinking they have meningitis. Okay, I'm thinking they have meningitis. Okay, so let me bring this over because this is something that you're gonna.
is coming.
Yeah.
Okay.
your money.
So
Don't worry about it. If you ain't my husband in time, it's my money.
okay.
Yeah.
Oh,
Right.
So hold
sorry.
on. Okay. So nuchal rigidity. So this is what we're thinking that they have meningitis. Okay. And so the test for nuchal rigidity is going to be Koenig's and Brudinsky's sign. Right. So if I have a patient, and so the reason why I brought this up was not necessarily to go down a med surge road, but I know in my nursing mind, my critical thinking, if they have pain in their neck, headache, they can't bend their neck, they have a fever, I'm thinking they may have meningitis. I know that I better isolate this patient because meningitis is extremely contagious, right? So that's why I mentioned that, okay? All right, let me see. Oh, wait, this is the wrong PowerPoint. Sorry. 28. Okay, so that's why it's important to know these clinical cues as to what's going on with your patient. And that's going to tell you that, okay, I need to put that patient in isolation. Okay, any questions about the transmission-based precautions? And I'm going to post in the classroom, the CDC has like a handout with the kinds, and there may be one in your book that tells you, okay, if they have this condition, what kind of isolation should they be in? That's definitely something you're going to need to know for your NCLEX. And that's something that test questions can be made of as well. Okay. The other thing that you need to know is how to properly don and doff your protective equipment. Don and doff. So I'll definitely post that because I have seen questions, test questions on that as well. The big thing that I think students always miss is that the gloves have to come off first because they are the most contaminated. Okay, you want to remove what's contaminated, the most contaminated first. And then when you're removing your gown, you roll it away from your body. Okay, and then in lab, you're also going to go over specimen collection, bagging the trash and linen. We kind of talked about that a little bit already, and transporting the patients, meaning that, okay, the patient has to never just have a patient in a gown. They have to have it, covering over them if they're in a bed or a stretcher in a wheelchair. And if they have something that is potentially infectious, they need to have on a mask. Okay. Okay, and here we have a healthcare professional with the N95. Okay, implementation, the role of infections control. It's all of our jobs to keep our patients safe, to keep each other safe. If there has been an exposure, we have to notify our chain of command right away. If you have a test question that says little Johnny was bitten by little Susie at daycare, or a nurse has a needle stick, anything that compromises the skin, we have to wash that site with soap and water. That's always your first thing to do. And then you'll go through the protocol of if it's a needle stick, you'll have to get blood drawn. The patient will have to get blood drawn. You'll have to get your blood drawn every 3 months, 6 months, 9 months, and then a year to see if anything has developed. Okay, so that's with that. Surgical asepsis. This is when you're preparing your patient for a surgical procedure. So we talked about the principles and what happens. So, you know, keeping everything clean, and you have to keep your, if you hold up your arms, you bend at your elbows and your fingertips are pointing towards the sky. That's how you have to keep your hands when we're talking about surgical asepsis. So if you've seen it in movies, they're always like holding up their hands, right? And like, okay, don't touch me, I'm sterile. So that's a joke, but that's actually really true, because you want to keep your hands in that position because you don't want anything going down the fingertips, because then that can contaminate the patient. Usually the surgeon will be dressed or help to be dressed by a surgical tech or a scrub tech so that they maintain their sterility. Okay, non-sterile gown. Okay, great, great, great. Okay, let's see. Okay, so this is how you're putting your things inside of your sterile field. Okay, this kit that this nurse has, and this nurse has way too long nails, by the way, but this kit that the nurse has, everything inside of it is sterile. Okay, so what this nurse is doing, it looks like they have a blue cloth set up, and inside that container is going to be everything that's sterile. Okay. Okay, so evaluation, again, the last part of our nursing process. Okay, have we met the patient's expectations? Have we controlled any infection control? Have we spread infection to the patient? Okay, now these are safety guidelines, standard precautions. What does that mean? Treat every patient as if they have something you don't want to take home to your family. Okay, use clean gloves when you anticipate contact with bodily fluids. And I would submit to you, anytime you pull back the covers, wear clean gloves because you never know what you're going to find. Okay, you never know what's going to be under those covers. Use gown mask and eye protection where there's a risk for splashing. That is definitely something test questions are made of. Okay, keep your bedside tables clutter free. Clean equipment that is shared between patients, and making sure that patients cover their nose and mouth. Okay, use the tissues, dispose of the tissues, sanitize hands. Okay, that ends this chapter. Any questions?